my name is Abigail Carroll. I'm going to be filming my Proficiency number 2 video today for the basic exam. I am in my con uniform with my con ID badge, my watch, my stethoscope. I have my pen light with me, and then I also have a cotton ball laid out for which I'll use later in the exam. This is my mom, Joanna, and she'll be my patient today. So now I'm going to go ahead and get started. So first, when I walk in the room, I'm going to sanitize my hands. Hi, my name is Abby. I'm going to be your nurse today, doing your basic exam. Before I get started with anything else, can I offer you a drape?
I don't need one, thank you.
Okay, sounds good. So as I said, we're going to be doing the basic exam today. If along the way you have any questions, just stop me and let me know. Before we start, do you have any questions for me?
I do not.
Okay. And then I also just want to ensure your confidentiality, that everything we do here today will be kept confidential between me, you, and your healthcare team. Okay?
Okay.
All right, so we'll go ahead. To begin, I'm going to have you just confirm your name and date of birth for me.
Joanna Carroll, 4773.
Okay, and then I also note you don't have an allergy band of any sort. Do you have any allergies I should know about?
I do not.
Okay, great. So, so far, how has your hospital stay been? Have you been comfortable here?
Very comfortable.
Okay, great. And have you had any family come to visit you?
Yes, my husband.
Okay, great. That's awesome. So now I'm going to ask you just a couple of silly questions. Just answer them honestly for me, and I'm going to get a good gauge of some information that I need. So can you tell me what today's date is?
April 10th, 2020.
Okay, and then can you tell me where you are?
Yes, OSF Medical Center.
Okay, and then can you tell me why you're here?
For a physical exam.
Okay, and then do you remember what you had for breakfast this morning?
Oatmeal.
Okay, and then can you tell me what your first car was?
Camaro.
Okay, and I did ask your husband before you began, and he ensured that you did have oatmeal today for breakfast, and that a Camaro was in fact your first car. So that's all looking great so far. I note that the quality of your speech is great. Your choice of word is normal and acceptable. So everything's looking great so far. So to begin my physical exam, I'm going to start with your eyes. I'm going to have you go ahead and just close your eyes for me. I'm going to just move your hair out of the way here so I can get a good view at your pupils. I'm going to place my hand at your nose, and I'm going to have you open your eyes for me, and I'm going to shine a light. Okay, so pupils are reactive to light. Now I'm just going to place my pen light at your nose, and I'm just going to have you follow the pin. Okay, that looks great. So now I'm going to hold my pen light up to your face, and I'm going to measure the diameter of your pupils. Go ahead and just look at my nose. Okay, pupils are measuring 4 millimeters bilaterally, so that looks great. Now I'm going to go ahead and use my pen light to get a good look inside your mouth. I'll just have you open and say ah for me.
Ah.
Alright, and your mucous membranes inside the mouth are pink and moist, which is great. I don't notice any extra redness or mucus, but have you had a cough of any sort or extra mucus coming up?
No.
Okay, so cough and secretions are not present at the time. So I note just on observation that your skin color is even throughout your body to your face, from your chest to your upper and lower extremities. It's pink to pale. I note no abnormal rashes or lesions of any sort. I'm going to go ahead and now just be pinching right at the collarbone. This is to check your skin turgor. I'm just going to pinch here, and that looks great. So now I'm going to go ahead and move into a sensation test that I'll be using the cotton ball for. So I'm going to have you close your eyes for me, and each time you feel me touch you with the cotton ball, just say yes.
Yes, 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 yes.
Okay, so that looks great. Now I'm going to go ahead and be using my hands to touch your arms and legs. I'm going to first be touching just to feel the general temperature of your extremities. So I'm just going to use the back of my hand for that. All of your extremities bilaterally are warm to the touch, so that's wonderful. I'm now going to use the pads of my fingers to palpate for any edema. So I'm just going to be touching your arms and legs again. have no palpable edema upon examination, so that's also wonderful. Now I'm going to go ahead and move to your hands. The first thing I'm going to do is I'm going to check what's called capillary refill. I'm going to just pinch each of your nail beds, and it's going to tell me a little bit about your oxygenation and blood flow to your extremities. So I'm going to begin with that. Okay, and capillary refill to all 10 digits on the hands are less than 2 seconds, so that's wonderful. Now I'm going to be using 2 fingers on each hand to go ahead and palpate your radial pulses. Okay, and pulses are 2+ bilaterally to your radial pulse, so that's wonderful. Now I'm going to do the same thing, just move down to your toes. I'm going to first do that capillary refill. Alright, and capillary refill to the all 10 digits are less than 2 seconds, so that's wonderful. Now I'm going to be checking the pulses at your dorsalis pedis site. And pulses at dorsalis pedis are 1+ bilaterally. So now I'm just going to sanitize my hands since I did touch your feet before I move on with the rest of my exam there. Okay, so now I'm just going to ask you a couple questions regarding your activities of daily living. So in a typical week, how often do you usually exercise?
5 times.
5 times a week, that's awesome. What type of exercise do you do?
A jog run.
Okay. Do you have any muscular or bony pains or tenderness that keeps you from doing those activities of daily living?
I do not.
Okay, that's great. I'm glad to hear all of that. So now I'm going to go ahead and move into the respiratory portion of my exam. So what I'm going to do is I'm going to be listening with my stethoscope. First I'm going to start with your back. Each time you feel my stethoscope touch your back, just take a deep breath with your mouth open for me. I'm going to lift up your gown, and I'll begin placing my stethoscope now in a zigzag formation. Posteriorly, breath sounds are clear to auscultation. I don't hear any excess secretions or any abnormal breath sounds, so that's great. Now I'm just going to be doing the same thing to the front side of you and listening to your lungs on the anterior side. Each time you feel me touch with my stethoscope, just take a deep breath. And breath sounds sound great anteriorly. I again don't know any abnormal breath sounds or hear any secretions as you breathe. I know that your respiration rate and pattern is normal, and everything looks good with your lungs so far. So now I'm going to go ahead and move into the cardiac portion of my exam. To do that, I'm just going to have you change positions here into a laying position we call supine. I have the bed elevated to 30 degrees. And now I'm going to just go ahead and begin the cardiac exam. So to do that, I'm just going to be listening to your heart in 5 different places. Each time I touch one of those places, I'm going to do so with my bell first, and then I'm going to start over and do it with my diaphragm of my stethoscope. You can just keep laying flat and breathing normally. I'm going to begin with my bell. Okay, so now I'm going to be switching to the diaphragm of my stethoscope. And I'm going to just again listen into those 5 places. Okay. Your heart sounds great and regular. Each of those heart sounds sounded great with both my bell and my diaphragm, my stethoscope. So that concludes the cardiac portion of the exam, and now I'm going to go ahead and move into my abdominal assessment. So for each of those, I'm first going to be just listening to the sounds in your abdomen using my stethoscope. You can just keep lying flat and breathing normally. I'm going to start in the lower quadrant. I'm going to be listening for 15 seconds each in each quadrant. Okay, I heard a total of 28 vowel sounds upon listening to each of the 4 quadrants. So now I'm going to go ahead and move into palpating your abdomen. Each time I palpate, if you along the way have any tenderness or pain, just stop me and let me know, okay? Any pain or tenderness so far?
No.
Okay. Any pain?
No.
Okay, that's great. So now I'm just going to ask you a couple questions about elimination. So about how many times a week do you how many times a week do you have a bowel movement?
At least 5.
At least 5, okay. So when you do have a bowel movement, is it normally loose or formed?
Formed.
Okay, and is the color of it, what is the color of it normally?
Brown.
Okay, that's great. Have you had a bowel movement today?
Yes.
And can you describe that bowel movement for me?
It was formed.
Formed?
And brown.
And brown. Okay. And then during a typical day for you, about how many times would you say you urinate?
About 10.
About 10, okay. And each time when you urinate, is the color usually bright yellow, pale yellow, or clear?
Clear to pale yellow.
Clear to pale yellow. Okay, that's great. And then when you do urinate, do you ever notice any specific odor?
I do not.
Okay, and then I also noted in the patient's chart that she has a history of a hysterectomy, so no need to ask about her menstruation. So, okay, and then I think that concludes our exam today then. Do you have any questions for me before I head out?
I do not.
Okay, I'll go ahead and help you sit up here, and then you can go ahead and get dressed and get your shoes on, and then I'll show you the way out.
Thank you.
Okay, thank you so much.